This video goes over a first rib mobilization. So a lot of times when the first rib gets elevated, it can feel like a lot of tightness and pain on here. Maybe you try to roll it with a ball, it doesn't go away. Sometimes the scaling, some of these muscles in the anterior neck can get really tight with how we're breathing or if we're stressed, and that can cause that rib to tighten up. That can even create a little numbness in your arm and hand. So I'm going to go over a way just to try to mobilize it down, create a little more space for that thoracic outlet for the nerves and arteries and veins to go down into your arm and hand. So you can use a strap, a dog leash, belt, bath towel, whatever you have handy. What I like to do is try to sit on the strap first. And then we're gonna go right on the shoulder, kind of close to the neck. I don't want to right on the neck. Make sure shoulders stay nice and relaxed. You're just gonna add a nice little down pressure into the belt, and you can kind of figure out where it feels the tightest. So you can do this mobilization a couple of ways. If we want to start with first, maybe just taking a big breath in, and then as we exhale, trying to take up a little bit of tension in the belt. The ribs commonly get elevated, like I said, with some dysfunctional breathing patterns. They also move with respiration, so using your breath can be a really powerful mobilization tool. You can also move your head, so we can just kind of gently go to the side and gently go back and forth. If you find one way feels a little tighter, maybe we can do that breath again, trying to breathe in, and then exhale. See if we can take up some of that slack. You can also try to stretch the scaling, so try to look up and away, and then come back and do that again, up and away. Try to keep the mouth shut if you can. Add the breath. Finally, you can use your arm. So again, keep that nice little tension on the strap, and you can lift the arm up and down, trying to go through higher ranges. You can also maybe add some nerve glides, trying to get median nerve, trying to get the ulnar nerve. So you can try a couple of things and see what works best for you. And then if you have any trouble, just come see Greg or myself at Laws of Motion.